When it comes to managing conditions like sleep apnea or respiratory distress, choosing between a continuous positive airway pressure and a bilevel positive airway pressure machine can feel overwhelming. These devices play a crucial role in ensuring that individuals maintain proper airflow while sleeping or during medical treatments. However, deciding which one is appropriate depends on several factors, including the individual's condition, comfort preferences, and medical needs. In this video, we'll explore the key differences, benefits, and scenarios in which each device is used to help you make an informed decision. Welcome to the History of Simple Things, where we delve into the fascinating history behind the little things that shape our world. Before we dive into the decision-making process, let's clarify what CPAP and BiPAP machines are and why they're used. CPAP stands for Continuous Positive Airway Pressure, while BiPAP stands for Bilevel Positive Airway Pressure. Both machines are non-invasive devices designed to help individuals with breathing problems, particularly during sleep. CPAP machines deliver a steady, continuous stream of air pressure to keep the airway open. BiPAP machines, on the other hand, provide two levels of air pressure: a higher pressure during inhalation and a lower pressure during exhalation. While CPAP is the go-to choice for many, BiPAP offers a more flexible option for certain patients. Understanding the difference between these devices is crucial, as the decision largely depends on the specific medical condition being treated and the patient's comfort and needs. Whether you're a patient trying to make an informed choice or a caregiver assisting someone, knowing when to use CPAP or BiPAP can significantly improve treatment outcomes. CPAP is most commonly prescribed for people with obstructive sleep apnea, a condition where the throat muscles relax excessively during sleep, causing the airway to collapse. This leads to interrupted breathing, which can result in poor sleep quality, daytime fatigue, and even more severe health complications like high blood pressure and heart disease if left untreated. By maintaining a steady airflow, CPAP keeps the airway open, ensuring uninterrupted breathing throughout the night. Another common use of CPAP machines is in cases of mild respiratory insufficiency or hypoventilation due to obesity or neuromuscular disorders. However, the effectiveness of CPAP is often limited to conditions where the patient can comfortably tolerate the constant air pressure. For those who find it difficult to exhale against the pressure or who have additional respiratory issues, CPAP may not be the ideal solution, which is where BiPAP comes in. BiPAP is typically recommended for individuals who need more complex respiratory support. Conditions like central sleep apnea, chronic obstructive pulmonary disease, and certain neuromuscular disorders benefit greatly from the two-level pressure system. Central sleep apnea, unlike obstructive sleep apnea, occurs when the brain fails to send the proper signals to the muscles that control breathing. The dual pressure of BiPAP can help stimulate the breathing process by mimicking natural respiratory patterns. For patients with COPD, exhaling against a constant pressure can feel restrictive and uncomfortable. BiPAP offers relief by reducing the pressure during exhalation, making breathing more natural and less taxing. Similarly, for patients with progressive neuromuscular diseases, BiPAP can provide essential respiratory support, especially as these conditions advance and weaken the respiratory muscles. The flexibility of adjusting inhalation and exhalation pressures makes it a versatile tool in managing complex cases where CPAP may fall short. Beyond the medical conditions, tolerance and comfort are critical factors in choosing between CPAP and BiPAP. Many patients start with CPAP since it's usually the first line of treatment for sleep apnea. However, some find it challenging to adjust to the constant pressure, especially during exhalation. This discomfort can lead to poor compliance with therapy, reducing its effectiveness. For these patients, switching to BiPAP can make a significant difference. The lower exhalation pressure on a BiPAP machine feels more natural and can encourage better adherence to the treatment plan. It's worth noting that newer CPAP machines come with features like expiratory pressure relief, which slightly reduces pressure during exhalation. But these adjustments are not as robust as the two distinct pressure levels offered by BiPAP. Healthcare providers often assess patient comfort during a trial period with CPAP before recommending a switch to BiPAP. Factors like mask fit, noise levels, and ease of use also play a role in determining which machine is better suited to an individual's needs. Choosing between CPAP and BiPAP is not a decision to be made lightly, and it's not one that patients should make on their own. Diagnostic tests, such as polysomnography or a sleep study, which provides essential insights into the nature and severity of a patient's breathing problems. This test measures factors like oxygen levels, heart rate, airflow, and respiratory effort to determine the best course of action. A physician or sleep specialist evaluates these results and considers the patient's medical history, current health status, and specific symptoms before recommending a device. For instance, if a sleep study reveals frequent central apneas, BiPAP or an advanced variant like adaptive servoventilation may be prescribed. If the study indicates straightforward obstructive sleep apnea without complicating factors, CPAP is usually the first choice. Healthcare providers may tweak the machine's settings or switch between CPAP and BiPAP based on the patient's response to therapy. This highlights the importance of regular follow-ups and open communication with your healthcare team. Another practical factor to consider is cost. CPAP machines are generally less expensive than BiPAP machines, making them more accessible for many patients. However, the higher cost of BiPAP reflects its advanced features and broader range of applications. Insurance coverage often plays a significant role in affordability, with many plans covering CPAP and BiPAP devices as durable medical equipment. It's important to work with your provider and insurance company to understand what's covered under your plan and whether additional documentation is needed to justify the use of BiPAP. So how do you decide between CPAP and BiPAP? The answer lies in understanding the underlying condition, patient comfort, and the recommendations of your healthcare provider. Remember, no two patients are alike, and what works for one person may not work for another. That's why it's essential to undergo thorough diagnostic testing, consult with a qualified healthcare professional, and prioritize comfort and compliance when choosing a device. With the right approach, both CPAP and BiPAP can transform lives by improving sleep quality, reducing health risks, and enhancing overall well-being. Thank you for watching. If you have suggestions for our next video, feel free to share them in the comments below. We'll be sure to give you an acknowledgement for your contribution. Thank you for joining us on this journey through the history of simple things. Don't forget to like, subscribe, and stay tuned for more stories woven through the smallest details.